Welcome. My name is Gene Jones. I'm the executive director for an organization called the Southern Waste Information Exchange. We're a small nonprofit out of Tallahassee that assists industry and municipalities with waste issues. We also provide some assistance to the department with regard to environmental issues. We do a lot of webinars like this and various tasks for the department in the area of solid waste and recycling. This is one particular webinar that we were asked to provide assistance in. Today's webinar is really designed to provide information on waste management related to reverse distribution facilities. I'm going to ask for everybody to do the following as we do this. First off, this webinar is being recorded, and we will make the recordings available to everybody. As everybody's coming into the system, I'm accepting everybody. I'm trying to turn everybody's microphone off, so I ask that you do that while we run this webinar. Like I said, the webinar is being recorded, and we will make that available along with a PDF of the presentation after the webinar is over with. And then we'll open it up to Q&A after our speaker Alannah Irwin presents her presentation to us, and then we'll open it up to everybody for Q&A through the chat system. So with that, Alannah, I am going to turn it over to you.
Let me see. Yes, I can share my screen now. Okay, can you guys see that?
We got you.
All right. So I'm just going to quickly introduce myself, and I'll turn my camera on so you can see me. My name is Alannah Irwin. I'm an environmental manager for the compliance assurance program here in the Southeast District Office. I oversee the compliance programs for air, hazardous waste, solid waste, and UIC here in the Southeast region of Florida. So I first off want to thank Gene and Glenn for asking me to do this presentation today. I'm really excited to talk about the reverse distribution requirements just because the rules are so new and they're so unique compared to other RCRA regulations. So with that, I'm going to go ahead and turn off my video and get started. And like Gene said, we're going to be doing questions at the end. So if you do have any questions, just try to hold them. My presentation should be about 40-ish minutes or so. So there should be enough time for questions at the end. All right. So with that, I'm going to be talking about reverse distributors today. These are the new rules under 40 CFR 266 Subpart P that became effective in Florida in August of 2019. So I'm going to be talking about today just some common definitions that you're going to be seeing when we talk about Subpart P in general. I'm going to be going over the reverse distributor requirements, what to do when you're shipping these potentially creditable hazardous waste pharmaceuticals, evaluated hazardous waste pharmaceuticals, excuse me, and how to manage these evaluated pharmaceuticals. I'm also going to be talking about the sewering prohibition and then just providing a list of reverse distributors in Florida. So some new definitions that were created as part of this new Subpart P rule. The first one is reverse distributor. And a reverse distributor is any person that receives accumulates prescription pharmaceuticals. I want to point out the prescription part because a lot of times people will think that they're doing over-the-counter medications. That is not considered reverse distribution. It's specific to prescription pharmaceuticals, and they have to be potentially creditable hazardous waste pharmaceuticals. And the purpose of reverse distribution is to make sure that these potentially creditable hazardous waste pharmaceuticals are being evaluated for manufacturer credit. So that's really what reverse distribution is. That's what EPA has defined as a reverse distributor. So it does include forward distributors and third-party logistics providers and manufacturers that are evaluating and processing potentially creditable hazardous waste pharmaceuticals. And I'll go into that in a little more detail, but it does not include reverse logistics for non-prescription pharmaceuticals. So just kind of keep that in mind as we go through this presentation, because that's a lot of, as we do these inspections, that's what we're finding is a lot of facilities think they're reverse distributors, but they're really not. So the next definition is potentially creditable hazardous waste pharmaceuticals. And you'll see throughout the presentation, we'll be calling them HWPs or haz waste pharmaceuticals. This is a prescription hazardous waste pharmaceutical that has a reasonable expectation to receive manufacturer credit. And in order to do that, it has to meet 3 criteria. It has to be in the original packaging, except if the pharmaceuticals were subject to a recall, undispensed, and unexpired, or less than 1 year from the expiration date. So this potentially creditable hazardous waste pharmaceuticals terminology doesn't include evaluated. And that's another definition that we'll be talking about in a minute. And it also does not include non-prescription pharmaceuticals. So only prescription pharmaceuticals can be considered potentially creditable. And it must meet these 3 expectations in order to be considered potentially creditable. If it's not meeting any of these criteria, it is not a potentially creditable hazardous waste pharmaceutical and needs to be managed in accordance with 266 Subpart P. Non-creditable hazardous waste pharmaceuticals are prescription hazardous waste pharmaceuticals that don't have a reasonable expectation for credit, which typically means they're not eligible for manufacturer credit. Non-creditable pharmaceuticals are also non-prescription pharmaceuticals that don't have a reasonable expectation to be legitimately reused or reclaimed. So there's a huge list of what's considered a non-creditable hazardous waste pharmaceutical. It includes free samples, investigative drugs, residues in empty containers, contaminated personal protective equipment, floor sweepings, and cleanup materials. So if you have a hazardous waste pharmaceutical that spills, it maybe is a P-listed, what would be considered a P-listed pharmaceutical if it were to be sent for destruction, and you have contaminated equipment or floor sweepings, that would also be managed this way. So that's something that's one of the new definitions that came out of these regulations when they promulgated Subpart B. And then the next term is evaluated. And evaluated is a specific term to reverse distribution. It means that these prescription hazardous waste pharmaceuticals have been evaluated by the reverse distributor and will not be sent to another reverse distributor for further evaluation or verification. And I'll talk about what this means in a little more detail. But for example, if you think of you send your pharmaceutical to the reverse distributor, they have a certain period of time to review it and evaluate it. And in that time period, they can decide if they're going to send it to another reverse distributor because maybe they don't accept the manufacturer's credit or can't work with the manufacturer, but someone else can. They've decided that it's not creditable, so it's going off for destruction. So those are just some examples that where an evaluated pharmaceutical will come into play. So now I'm going to talk about the standards of management under the reverse distribution rules. These new reverse distributor regulations can be found under 266.510. We have adopted this in our state of Florida administrative code. So just keep that in mind if you are a reverse distributor or you're inspecting reverse distributors if you're part of an SQG program. And these standards discuss this potentially creditable hazardous waste pharmaceutical management and evaluated hazardous waste pharmaceutical management at reverse distributors. So reverse distributor, one of the main requirements is a notification. You need to have an EPA ID number. Most of our reverse distributors do, but you have to notify under Subpart P as a reverse distributor. And for now, you'll have to use the EPA form. We are working to get our state form updated with the pharmaceuticals requirements, but make sure you obtain that EPA ID number. This notification was due back in October of 2019, so some time has passed, but make sure your notifications are up to date within 60 days of the effective date of Subpart P or within 60 days of becoming subject to this part. The next requirement is there needs to be a delivery confirmation. So the reverse distributor once they receive a shipment of potentially creditable hazardous waste pharmaceuticals, so pharmaceuticals that you're accepting, that you're going to be taking time to evaluate to see if there's a reasonable expectation of credit, you need to provide a delivery confirmation to the healthcare facility, or if it came from a reverse distributor. So that's really important. We need that delivery confirmation when we're doing our inspections to make sure that it's a legitimate, reasonable expectation of credit. It has to be a potentially credible hazardous waste pharmaceuticals. Reverse distributors cannot receive non-creditable hazardous waste pharmaceuticals, and I really want to emphasize that. So you need to provide this delivery confirmation to the healthcare facility or the other reverse distributor just to make sure that the potentially creditable hazardous waste pharmaceuticals have arrived and are under custody and control of your facility. This delivery confirmation is required to be sent to the shipper within 35 days. So just keep that time frame in mind. Record keeping and reporting requirements for reverse distributors. A reverse distributor must maintain a current inventory of all potentially creditable and evaluated hazardous waste pharmaceuticals on site. And it needs to include the identity. This could be the name or the national drug code that is associated with the pharmaceutical, and the quantities. And these are records that we would look for if we were to do an inspection of a reverse distributor. So just make sure you have all of those record keeping requirements at your facility for any upcoming inspections that you may have. And then another requirement for the reverse distributor is really the evaluations of pharmaceuticals. So a reverse distributor that is not a pharmaceutical manufacturer must evaluate a potentially creditable hazardous waste pharmaceutical within 30 days of receiving that waste. And in that 30-day period, it's on the reverse distributor to determine if the hazardous waste pharmaceutical is destined for another reverse distributor to be further evaluated. They need to verify that the haz waste pharmaceutical qualifies for manufacturer credit, and they need to determine if it needs to be shipped off to a permitted TSDF. If that third option occurs, that means that it's considered an evaluated hazardous waste pharmaceutical. It's not able to get any manufacturer credit, and it needs to go to a RCRA permitted facility for proper disposal. And those evaluated pharmaceuticals become to specific requirements in 40 CFR 266.510 paragraph C. So the evaluation of hazardous waste pharmaceuticals, if you're a reverse distributor that is a manufacturer, you still have to evaluate within 30 days of receiving the waste, but you have to, following this evaluation, much like the other one, you still have to comply with the requirements for evaluated hazardous waste pharmaceuticals. In the past, we've seen facilities where if they're a pharmaceuticals manufacturer, they bring it in and then they consider it their own waste, and then they just kind of manage it as their own. And they can't do that anymore. They have to keep it specific to the healthcare facility that it comes from. They have to follow the evaluated criteria under this paragraph C of 266.510. So just make sure that you're aware of what records and what procedures you need to follow when you're evaluating hazardous waste pharmaceuticals. So there's a maximum accumulation time. So you have that 30-day evaluation period, and then you've determined that the hazardous waste pharmaceutical is no longer creditable. You have 180 days from the evaluated dates to keep it on site and get rid of it. So that you have a total of up to 210 days for both potentially creditable hazardous waste pharmaceuticals and evaluated hazardous waste pharmaceuticals. So you have to decide if you're going to send it to another reverse distributor, or if it's no longer creditable, it's beyond a year beyond the expiration date, 2 years beyond the expiration date, and it's not eligible for manufacturer credit. So the 180-day period will start after evaluation and applies to all hazardous waste pharmaceuticals, regardless of whether or not it's going to another reverse distributor or a TSD. So just keep that in mind. Keep awareness of your timeframes, because If you exceed that 180 day, you would need a RCRA permit, and then you can run into a whole bunch of compliance issues at that point. So I want to just give some examples of the maximum time accumulation. So unexpired pharmaceuticals that are otherwise creditable but are awaiting their expiration date can be accumulated for up to 180 days after the expiration date. And an example of that would be aging in a holding morgue. I'll explain that in the next slide about aging pharmaceuticals. So if you're a reverse distributor that's accepted a potentially creditable hazardous waste pharmaceutical, but it's kind of near that deadline, or you're not sure that you're going to be able to get it out before the deadline, your 180 day clock will start after the expiration date. Another example of that is if it's an unexpired pharmaceutical that you're waiting, you're holding it, it needs to comply with the standards of management for container labeling that I'll discuss in a little bit. So I want to talk about this aging pharmaceuticals. What does it mean? An aging pharmaceutical means if the pharmaceutical is creditable, the reverse distributor can hold on to it for a specific time in a specific area, and it can remain there until it's expired. And once it's expired, the 180-day accumulation period begins. So just like I said, keep awareness of your timeframes. Make sure that you're paying special attention to your evaluation periods and your 180-day accumulation periods. And while it is being stored in the designated area, an inspection needs to be conducted every day or every 7 days, and it needs to be handled only by trained personnel and needs to be labeled as hazardous waste pharmaceuticals, and it has to meet the standard container requirements, closed, in good condition, waste compatibility, so on and so forth. So even though it's in a holding area where it's waiting to meet its expiration date, it's still subject to these standards. A new requirement for a reverse distributor, at least in terms of Subpart P, is security. A reverse distributor has to have a way to prevent unknowing entry or minimize the possibility of unknown entry. They have to have security procedures in place for the portion of the facility where the potentially creditable hazardous waste pharmaceuticals and evaluated hazardous waste pharmaceuticals are being kept. So this can be 24-hour continuous surveillance systems, an artificial barrier such as a locked fence, key card access, or other ways to control entry. But you just have to make sure that you are meeting the security requirements. And if the reverse distributor already meets the security requirements because of regulatory requirements from other agencies, such as the Drug Enforcement Administration, the facility is not required to have separate security measures. So just make sure that you can demonstrate you have adequate security in the portions of the facility that are managing these pharmaceutical waste streams. Another new requirement for reverse distributors, and it's very similar, it's actually the same thing as a large quantity generator. So a reverse distributor must comply with all of the emergency preparedness requirements in Subpart M. So this includes having a contingency plan, having a quick reference guide, making your arrangements with the local authorities, having adequate aisle space, a designated emergency coordinator, and then maintaining and operating your facility to minimize releases and sudden, unplanned events. So a reverse distributor will need to comply with those emergency preparedness and prevention measures that are listed in Subpart M. Another new requirement, and this is very similar to the LQG requirements again, it's the closure. If you're going to close your facility or you're going to close an area that might be holding hazardous waste pharmaceuticals, you have to provide the notification for the facility closure that is very similar to the LQG closing their facility in 26617. And then once you're in the process of closing your facility, you have to make sure it meets the closure performance standards in that 26217 as well. So just keep that in mind. If you do ever have to close your facility, you do have these specific requirements that you have to meet that are very similar to the LQG requirements. And reverse distributors, some more record keeping requirements. They're required to Submit any unauthorized waste reports to the department within 45 days of receiving the waste. So if you're receiving non-pharmaceutical waste, if you're receiving lab waste or staining waste or anything that is not a pharmaceutical, you need to reject that shipment and make sure that you are sending us a notification that you received unauthorized waste. And yes, you have to notify the facility as well where the waste came from, and you have to manage the waste. Either you can reject it and send it back to them, or you can manage it under your own requirements, but just make sure that you are complying with the appropriate standards for RCRA if you are receiving waste that is non-pharmaceutical waste. So the next record keeping and reporting requirements, like I said earlier, you have to notify and maintain a copy of that form. You have to maintain a copy of the delivery confirmation and shipping papers for all of your shipments of hazardous waste pharmaceuticals. And you have to maintain copies of any unauthorized waste. All of these records have to be maintained for at least 3 years. And you also need to maintain a copy of current inventory. Though most of the reverse distributors do have an inventory system in place. So as long as you guys have a way to scan in and scan out your inventory to know how much you have on site, what types of pharmaceuticals you have on site, and if they're evaluated or potentially creditable, those are some things you'll want to make reference to when you're managing your pharmaceutical waste. So now a new standard that I'm going to be discussing is the shipments of potentially creditable hazardous waste pharmaceuticals. And remember, these are the pharmaceuticals that you're receiving from either other reverse distributors or other healthcare facilities with a reasonable expectation of credit, and they meet those 3 requirements we discussed earlier. So for shipping potentially creditable hazardous waste pharmaceuticals, any reverse distributor who transports or offers for transport potentially creditable hazardous waste pharmaceuticals, they must comply with the applicable US DOT regulations. Very similar to the pre-transport requirements for generators. So just make sure you have all your placarding, your labeling, if you need to have any UN codes, so on and so forth. And potentially creditable hazardous waste pharmaceuticals do not require a manifest, because it is technically not considered hazardous waste at that point, because there is a reasonable expectation of credit. So it is not considered hazardous waste under the DOT regulations, and you can follow whatever applicable DOT regulations would ensue as you ship the waste. So you do not need to manifest potentially creditable hazardous waste pharmaceuticals, and just make sure you're complying with the DOT regulations when you ship it off. So for potentially creditable hazardous waste pharmaceuticals, you have 180 days to either ship to another reverse distributor or send it off for evaluation if it is no longer considered potentially creditable. And remember, you have that 30-day evaluation period. So the total accumulation time is up to 210 days. And potentially creditable hazardous waste pharmaceuticals, you can receive them from either a healthcare facility or a reverse distributor. It doesn't matter, the timeframes still stand. So offsite shipments of the potentially creditable hazardous waste pharmaceuticals need to comply with the requirements from the previous slides, where it doesn't, if it's potentially creditable still, it only needs to comply with DOT regulations. You don't need to keep a manifest, but you do need to keep an inventory and all the shipping papers. So if you're sending it from your reverse distribution facility to another reverse distribution facility, you have to make sure that you have all of your shipping papers in place from start to finish. And these records need to be maintained for 3 years. Like we talked about earlier, there needs to be a delivery confirmation, and this needs to be sent to the shipper within 35 days. So you should be sending your healthcare facilities a delivery confirmation, some kind of receipt, some kind of paper. It can be electronic, can be paper, it doesn't matter, that shows that you have received the waste and it is under your custody and control. So keep that in mind. This is a really important part, because this is the way that potentially creditable hazardous waste pharmaceuticals are able to demonstrate the cradle to grave component of RCRA without being subject to the stringent regulations of manifesting and all of the requirements under the RCRA rules. Another, like I said, needs to be shipped. A delivery confirmation needs to be received within 35 days. And if it's not received in 35 days, the reverse distributor that initiated the shipment must contact the carrier and the intended recipient to report any issues. You need to let them know, hey, we did not receive the shipment, or you need to have the healthcare facility let them know, hey, the shipment was not received. You need to find out where it is. I don't think this is entirely a common scenario, but it does happen. So you'll want to make sure that you're doing your due diligence and keeping track of your 35 days, because the shipping paper needs to go to the healthcare facility or the other reverse distributor. And you can import and export potentially creditable hazardous waste pharmaceuticals, but you must comply with the transboundary movement requirements under 40 CFR 262 Subpart H, with the exception of the manifesting requirements. So you'll still need to notify the EPA regional office that you're importing or exporting pharmaceuticals, and you'll need to comply with all the other requirements except the manifesting requirements. And then on top of it, you'll also have to comply with the standards for the managing, the evaluating, keeping the records on site, so on and so forth, and the delivery confirmation. So there is the option to export potentially creditable hazardous waste pharmaceuticals under this new rule. And the same thing with the importing. The only thing that's really different is that you'll comply with the main paragraphs of 266-509 in lieu of Subpart H. It's very interesting how they did that. But it is potentially creditable, which the idea of potentially credible is it might not be a waste yet. But the second those potentially creditable hazardous waste pharmaceuticals do enter the United States, they are subject to 266-509 from reverse distribution. So just make sure that you're aware of the import and export requirements if you do that at the reverse distribution facility, or you have facilities that you maybe regulate or inspect that are importing and exporting, because there are some additional requirements that they may be subject to. So evaluated hazardous waste pharmaceuticals. So these are the pharmaceuticals that were evaluated in that 30-day period and determined to not be eligible for credit. These are the ones that become evaluated hazardous waste pharmaceuticals and are designated for a permitted RCRA facility for destruction. So before offering your evaluated hazardous waste pharmaceuticals for transport, you need to comply with the packaging, labeling, and marking requirements for DOT for hazardous materials, which I want to make a note of that. It's different from RCRA. So RCRA will require you to manage in accordance with the pre-transport requirements, but evaluated hazardous waste pharmaceuticals need to comply with the DOT regulations for hazardous materials. And then prior to shipping it from your reverse distribution facility, you will need to mark the containers with the applicable waste codes, and a nationally recognized electronic system. Could be barcoding, could be radio frequency ID, and you may use that to identify the EPA waste codes. So this is a big difference from healthcare facilities and reverse distributors. Under Subpart P, healthcare facilities are not required to use waste codes for their hazardous waste pharmaceuticals. They just use the waste code farms. Instead, the reverse distributor is required to use the EPA waste codes for their shipments of evaluated hazardous waste pharmaceuticals. So if you're shipping containers of 119 gallons or less, just make sure you're marking it with these the hazardous waste. Usually the yellow or orange hazardous waste labels will satisfy this requirement. Just make sure that you're complying with all the applicable shipping regulations when you do ship off your hazardous waste, evaluated hazardous waste pharmaceuticals. So also you do have to use the manifest since you're using the waste codes. Just kind of keep that in mind that you're using the manifest also. And you have to comply with the requirements of 40 CFR 262 Subpart B for transport. So this is for your evaluated pharmaceuticals. Then a reverse distributor, you must keep a copy of the manifest for 3 years until it receives a signed copy from the designated facility. And the signed copy must be maintained for at least 3 years. It's very similar to shipping off hazardous waste if you were to ship off hazardous waste. It's just the differences of the timeframes and the there's really one destruction method for pharmaceuticals, which makes it a little easier as far as when you're dealing with land disposal restrictions or anything like that. But you just have to make sure you are identifying all of your waste codes when you're managing your evaluated hazardous waste pharmaceuticals. Speaking of management of hazardous waste pharmaceuticals, you have to make sure that you're packaging, labeling, and shipping your non-creditable hazardous waste pharmaceuticals in compliance with DOT, and make sure it goes to a permitted facility. So evaluated hazardous waste pharmaceuticals on site as they're being held in their 180-day accumulation area. There needs to be a designated area, and they have to do inspections at least once every 7 days to make sure that they are not leaking, there's no damage, there's no any other signs of could cause a release from the containers. And then you must keep a log. This can be written or electronic, documenting these weekly inspections that you do. And you have to keep those records for 3 years from the date of the inspection. Reverse distributors that are managing evaluated hazardous waste pharmaceuticals need to comply with the LQG requirements for training. So everybody that's involved with the management of the evaluated hazardous waste pharmaceuticals need to have an initial training within 6 months of hire. They need to have an annual review. They need to make sure that they're aware of all the emergency preparedness and prevention requirements. They need to have position descriptions. All of the LQG requirements need to be met when you're managing evaluated hazardous waste pharmaceuticals, and maintain these records until the facility closes or at least 3 years after the employment ends. Reverse distributors managing evaluated hazardous waste pharmaceuticals need to label and date and close the container, all in the accordance with the requirements for like SQGs and LQGs. The only difference is it has to be labeled with the words hazardous waste pharmaceuticals. You can't label it any other way. EPA specifically wants it labeled hazardous waste pharmaceuticals, not waste pharmaceuticals or hazardous waste or any other combination. Make sure your containers are in good condition and closed, and manage to prevent leaks or damage or anything like that. You can also have to make sure your containers are lined or made with materials that won't react. And there has to be waste compatibility with the evaluated hazardous waste pharmaceuticals. So very similar if you're a generator, very similar to the LQG requirements for managing your waste. Like I said, make sure your containers are closed. Make sure that you're managing containers of ignitable or reactive evaluated hazardous waste pharmaceuticals to prevent heat, fire, explosion, violent reactions, so on and so forth. Just make sure that you're maintaining those containers to prevent a release. Because remember, you're a reverse distributor and you're subject to the preparedness and prevention requirements under 262 Subpart M. So you really want to make sure that your containers are being managed accordingly. So the last thing I want to talk about for container management is accumulating evaluated hazardous waste pharmaceuticals that are prohibited from being combusted because of the dilution prohibition. An example would be arsenic trioxide, need to be maintained in separate containers from their evaluated hazardous waste pharmaceuticals. And note that a reverse distributor that accepts potentially creditable hazardous waste pharmaceuticals from offsite must comply with the LDR restrictions, the land disposal restriction requirements in 268.7A. One of the new things that's all facilities subject to Subpart P is the sewering prohibition. So this is something that it doesn't matter if you're a healthcare facility, you're doing third-party logistics, you're a reverse distributor. No healthcare facility, no reverse distributor can sewer any hazardous waste pharmaceuticals. So the new rule under 266.505 says all healthcare facilities, including very small quantity generators operating under 262.14 and reverse distributors, are prohibited from discharging hazardous waste pharmaceuticals to a sewer system that passes through a publicly owned treatment works. So healthcare facilities and reverse distributors remain subject to the prohibitions under the Clean Water Act and 40 CFR 403.5B1. So just keep that in mind. Make sure that you are not sewering any of your hazardous waste pharmaceuticals. It is a serious offense if you do that. It is a major extent of deviation, and it's one of the main things that Subpart P was kind of built on, is making sure we're no longer sewering hazardous waste pharmaceuticals. So I just wanted to quickly talk about Florida reverse distribution. So reverse distributors in Florida are required to register under the Department of Business and Professional Regulation, or DBPR. They're the agency responsible for issuing any permits for facilities that want to operate as a reverse distributor of prescription pharmaceuticals. So if you'll be getting this presentation, if you need to go ahead and register, you can go ahead and click this link here. It's the Florida DBPR. You can do it all online. Get your registration if you don't have it already. Make sure that you have your registrations valid. I know in our district here in the Southeast, we are looking at your registrations just to make sure you are a reverse distributor if you're registered as such. So this is what the licensure looks like. This is where we do our license search. The license category is drugs, devices, and cosmetics. And the license type is restricted prescription drug distribution reverse distributors. And this is just a list that we found. This one is as of probably beginning of 2021, probably needs to be updated. But if you do not have, if you are a reverse distributor, an actual reverse distributor facilitating prescription drug reverse distribution, and you don't have an EPA ID number, please make sure you get your EPA ID number immediately, because this is one of the main requirements under Subpart P for that. And with that, I'm going to go ahead and I guess open to the floor to any questions. That's my presentation on reverse distributors today.
Thank you, Alannah. And if I can, let me go ahead and open it up to the chat. If anybody has questions, why don't you go ahead and type in your questions and submit them to Alannah, and we will go through that process.
I'm going to go ahead and just stop sharing my screen, I guess.
Okay.
Let's see if I can pull up the chat also. I know it was a lot of information, and if you do have any questions that you may not think of right now, or you encounter anything, my email and my phone number are on this presentation that you'll be receiving after today's webinar. So please feel free to reach out to me at any time. I'll be more than happy to assist.
I'm not seeing any questions come in, so I'll give it just a few more minutes. Everybody that is attending, just know that I will be shooting the Alannah's presentation, the PDF, or maybe you can send it to me, Alannah, send it to me,
Yep.
and I'll get it out to everybody.
Yeah.
And I'll also send with that email the recordings from today.
Okay.
All right. Well, I'm not seeing any questions come in, but I know there's going to be some. So I'm going to go ahead and conclude us for today. And thank you, everybody, for your participation.